You know, the thing about cardiovascular disease is it's critical to prevent because it's nearly impossible to reverse.
Cardiovascular disease is presented in a variety of ways, and we have a very large footprint of all of that in the state of Wisconsin. This is a great time to be in this space. We really have built and poised ourselves to really become a leader in care within Southeast Wisconsin and beyond.
Cardiovascular disease has a huge impact on families in Wisconsin. It's actually the #1 cause of death and disability. And so everyone is touched by cardiovascular disease.
I personally think we are in the best position to lead efforts for treating cardiovascular disease in Wisconsin because of the research we do, because of the infrastructure we have. So I think, you know, if you have access to that sort of high impact, groundbreaking research, you're going to make a lot of impact in how we treat disease.
I would really recommend that patients come to Froedtert NCW for their care because of the multidisciplinary way that we take care of problems. You really don't get that at any other places in Southeast Wisconsin or frankly most of the Midwest. If you come see a vascular surgeon, you don't just get a vascular surgeon. You get interventional radiology. You'll get cardiology and cardiac surgery, anybody who's appropriate to be involved in that case. And we work very seamlessly together.
I think the thing that excites me the most about the future of our program is probably the people we have. We've been able to recruit and bring in some of the brightest minds across the nation to really focus on improving the healthcare of individuals here in our community and focus on creating new and innovative ways to drive healthcare.
By doing genetic profiling, we can detect disease earlier, and we can also understand the predisposition to common diseases so that we can intervene earlier.
But the unique thing about here is, despite all the advanced levels of care that we have, the culture here is really focused on providing personalized care to our patients.
When you compare ourselves to other academic institutions, we are amongst the top 5 in the level of quality that we provide. So our outcomes are better, our patients are safer while they're here in our hospital. But more than that, it's our focus on research. That's really what differentiates us from those around us.
And I think the amazing thing that donors and families in the area, when they contribute to the medical college, it's going to come back to them because it's going to benefit not just families in Wisconsin, but patients and loved ones in the area.
So anything that donors can do along those lines to help us be able to implement some of these more creative solutions, demonstrate that they work so that we can scale them up is much appreciated.